Today we will discuss about clubbing in 5-mark short note series. So what is clubbing? So clubbing is a bulbous enlargement of the distal phalanges of fingers or toes. It is usually associated with loss of normal angle between the nail and nail fold. It is usually due to the chronic diseases of lungs, heart, gastrointestinal tract, liver or thyroid. So when you look at it, this is the normal nail. So the normal angle of the nail fold should be 160 degree, which is called a Lovibond angle. Whereas in case of clubbing, there will be bulbous distal phalange enlargement, which results in increased nail curvature resulting in greater than 180 degree. So what are the grades of clubbing? So the normal Lovibond angle between nail plate and the proximal nail fold is 160 degrees. In clubbing, this becomes more than 180 degrees. So in grade 1, there will be fluctuation and softening of the nail. In grade 2, there will be normal Lovibond angle. In grade 3, there will be increased curvature of the nail. In grade 4, there will be drumstick appearance. In grade 5, there will be hypertrophic osteoarthropathy with periostitis and joint pain. What are the tests for clubbing? So the first is Schamroth's windows test. So in this, we have to ask the patient to place the dorsal surface of the terminal phalanges of both the index fingers against each other. In case of normal finger, there will be diamond shaped window C, whereas it will be obliterated. So in case of Schamroth windows test, they have to keep the index finger against each other. The normal window will be present. Whereas in case of clubbing, there will be absent of this window. Now coming to Lovibond angle, the angle between the nail plate and the proximal nail fold is examined. It will be around 160 degrees and more than 180 degrees in Lovibond angle. Okay. And the third one is fluctuation test. So here the examiner presses the nail bend gently. In early clubbing, the nail bend feels soft and spongy due to increased tissue vascularity. Mechanism of clubbing. The exact mechanism is not fully understood, but normally large cells called megakaryocytes are broken down in the lungs. In certain lung and heart diseases, these cells bypass the lung circulation and reach the fingers. They release growth factors such as platelet-derived growth factor, which results in tissue proliferation, and vascular endothelial growth factor, which results in increased vascularity. They cause vascular proliferation, connective tissue growth, and swelling of the terminal phalanges, thus producing clubbing. Causes of clubbing. So there will be bronchogenic carcinoma, respiratory causes of clubbing. Bronchogenic carcinoma, bronchiectasis, lung abscess, emphysema, cystic fibrosis, interstitial lung disease, and pulmonary tuberculosis. Cardiovascular causes include cyanotic congenital heart disease, infective endocarditis, atrial myxoma. GI causes include inflammatory bowel disease, celiac disease, and gastrointestinal malignancy. Hepatic causes include cirrhosis of liver, primary biliary cholangitis. Endocrine causes include thyroid or unilateral clubbing. So vascular lesions, neurological lesions, and local vascular shunt are the main causes of unilateral clubbing. Differential diagnosis include paronychia, acromegaly, pseudoclubbing, and hypertrophic osteoarthropathy. In paronychia, there will be local inflammation around the nail fold. In acromegaly, there will be generalized enlargement of hands, feet, and jaw. In pseudoclubbing, there will be hyperparathyroidism and nail disorders. Hypertrophic osteoarthropathy, clubbing with periostitis and painful joints will be there. Clinical importance. Clubbing is important bedside because it may indicate serious underlying diseases like respiratory system, cardiovascular system, GI system, liver, and endocrine system. And it is an important case to check in the general examination during routine clinical examination. So what are the common Viva questions? So what is the earliest sign of clubbing? So softening and fluctuation of the nail bed. What is Schamroth sign? Obliteration of diamond shaped window between opposed fingers. What is normal Lovibond angle? About 160 degrees. What happens to Lovibond angle in clubbing? It becomes more than 180 degrees. Commonest respiratory cause, bronchogenic carcinoma. Common cardiac cause, cyanotic congenital heart disease. What is hypertrophic osteoarthropathy? Clubbing with periostitis, painful swelling of the joints. What are the growth factors that are implicated? Vegetarial endothelial growth factor and platelet derived growth factors. So to summarize, clubbing is a clinical sign which is a terminal part of the fingers or toes, and it becomes broad, round and bulbous with a normal loss of normal nail fold angle. Normally it is 160 degree and it is more than 180 degree in clubbing. The earliest sign is softening and fluctuation of the nail bed. Later the nail becomes more curved, the fingertip becomes a drumstick, and in severe cases it is associated with hypertrophic osteoarthropathy where there is painful periosteal new bone formation. So clubbing is commonly associated with chronic diseases like lung, heart, GI, liver and thyroid. Important causes include bronchogenic carcinoma, bronchiectasis, lung abscess, interstitial lung disease, cyanotic congenital heart disease, infective endocarditis, inflammatory bowel disease, cirrhosis and thyroid acropathy. So I hope this is useful. Thank you.